Hello, greetings from the United States. My name is David Page, and I am the director of the Pre-Hospital Care Research Forum at UCLA. I'm an affiliate faculty member for the National Association of EMTs and do a lot of work internationally for NAEMT. I also teach in the paramedic program at the Center for Pre-Hospital Care at UCLA, part of the David Geffen School of Medicine, and currently a paramedic at Allina Health and adjunct faculty member, senior lecturer at Monash University in Australia. It is an honor to be with you, even if it's remotely, to discuss really a wonderful association that I've been a part of since 1987. I've actually been teaching NAEMT courses since that time. I took the pre-hospital trauma life support course in 1987 and just fell in love with it. Our organization has 72,000 members and growing. It was formed in 1975. And we're proud to have amongst our ranks practitioners of pre-hospital care of all sorts of training. So paramedics, EMTs, physicians, nurses, anyone really involved in out-of-hospital care, or paramedicine as some are calling it now. NAEMT focuses on education and advocacy, research. We really want to advance our profession based on evidence. And our mission is to improve the quality of care. Really, that's both by supporting our members that are professionals and also by providing quality education that is essential to delivering the best care possible based on the latest standards. We are led by a board of directors. This is an elected board, and there are 18 staff members. We have 14 different committees and volunteer coordinators. I'm a member of the education committee, as an example. We participate in all sorts of advocacy for education and also for changes in legislation here in the United States. We are partners with a great variety of organizations that also represent physicians, firefighters, fire chiefs, emergency managers, government entities, as well as ambulance associations and healthcare officials. We also spend a bit of time in Washington, D.C., along with our colleagues trying to improve the laws that help protect our profession and help patients, as well as finding funding and preparedness for disasters, pandemics like the one we've been living in this past year. Our education is really what I'm here to talk to you about mostly. It is comprised of 12 different courses. They're really wonderful, and I wish I could spend all my time just talking about each one, and I would never stop. We have a catalog that actually describes these in great detail, but and it's available online at naemt.org. But I really want to tell you what they mean to me. And some of these courses, I think, are really a part of how we do our work in the US. I, for example, have worked for ambulance services that required PHTLS before you started to work. It's a bit like BLS or CPR certification, where everyone knows, and ACLS, where everybody knows how to interact with each other. We know what the latest techniques are for teamwork and crew resource management, for culture of safety. We advance with the latest techniques. When tourniquets, we found out, were better than just putting direct pressure, we immediately put those into the course. And the courses are highly specialized in some cases, and also a mixture of both active learning, such as participation in group discussion or cases, and a lot of simulation. We really think that hands-on learning and being able to interact with instructors and think critically is the most important. So we use the latest education techniques, which I'm very proud of in our education committee, to infuse those in all of the courses that we do. We also encourage people to practice safely. You see everybody here in personal protection, outside, in the environments that we're actually going to be working with the tools and the equipment that we're actually going to be working with. PHTLS is our longest standing course. We've had this, like I said, I took it in 1987 and started teaching it thereafter. It's a minimum of 16 hours, but you can teach it in many more hours. As an example, in some of the universities and paramedic programs here, it's taught throughout the entire semester, and the textbook is used as the trauma course textbook, at the end of which we actually give the final exam and certification. There are hundreds of simulations that are wonderful, but we always say a minimum of 16 hours is what's needed, especially if it's continuing education. We simulate the patient in whatever environment, including the ambulance. So this is not just a class that you would take and sit in a classroom for. We want to get students out of their seats. We have opportunities to do scenarios to start with, and then concentrate on what techniques we can improve upon if people are taking it, for example, as a continuing education course. All of our courses can be tailored to the specific protocols for the area that we're in. I've taught them, as in the case for advanced medical life support, which is more critical thinking, kind of a detective course of differential diagnosis. And we've taught this in Malaysia, in Kuala Lumpur. We had a wonderful course, as well as in the Philippines and in Mexico and Colombia. These are amazing courses that where teams of people, even if they're different levels of training, can collaborate to care for a patient and learn about very important complaints and how to create differential diagnoses. Of course, pediatrics is so important, and we have a robust program for pediatric care, as well as, this is in partnership with the American Academy of Pediatricians. And this course, I think, is wonderful because so many people are so uncomfortable with children, and it's very needed. One of our newer courses is the All Hazards course. This is a course that's dedicated to organizing a disaster or a group of people who are going to respond to the disaster, learning to plan for what the community might need. In Mexico, that might be an earthquake. In the Philippines, it might be a monsoon, or we think about what that community needs, and then we actually do a simulated disaster if we plan ahead and have time for it. So again, just a wonderful course on the how to manage disasters and all types of hazards. Another wonderful course, psychological trauma in EMS patients, a bit of psychological first aid, how to deal with the emotional components. And I love the geriatric course, for example. We have, this is a course where we have our students actually walk around with rocks in their shoes, and we put tape on their fingers to really simulate what it feels like to get old, like me. I've been doing this for 35 years, and so I can tell you that the bones, you know, the ambulance crashes, it feels like it's you know, been a while. So having these young students actually experience what it's like to lose a bit of your sight with eyeglasses that have some fog in them, and not have the mobility, really teaches them to live and empathize with people who are older patients. So the GEMS, or geriatric EMS course, is just a phenomenal course. And of course, our safety is incredible. The ethics and leadership is badly needed, I think, in our profession. Fascinating to talk about ethics. We have courses that are specifically for law enforcement responders and firefighters or military, like the TCCC course as the tactical combat course. We hope we don't need those things, but here, for example, we had a lot of civil unrest and had to learn to work in very dangerous environments. So these are really amazing. The First on Scene course is dedicated just for the initial person who arrives at the scene. And There is an extensive community paramedic, also mobile integrated health is a name we use for that. And if the vehicle operator course, that I can't express I wish I could show you some of the videos. These are not, this is not learning to drive fast, but it's learning to drive safely. Which it's really just a wonderful combination of different disciplines and courses that give us a great enrichment and technique and competencies, all of them evidence-based, all of them updated. We have specific committees that update these guidelines based on international standards and go out of our way to look for the latest evidence, evaluate it, and put it into practice in these courses, as well as looking at consensus statements and finding just exactly what is the best way forward to teach this. So latest teaching techniques, latest information in the courses, along with materials that are really well put together. Our national and international training centers are intended to, so if you're wanting to teach this, you would become an NAEMT training center. And we launch the course usually as a provider course, and then the instructors can take it as a student, and then they teach the class and we help them. So as an affiliate faculty member, I observe and assist and learn from them actually most of the time about how wonderful they do with their courses. And that's how the NAEMT training centers begin to teach their own courses. And these certifications really blossom. People are very proud to have them and proud to have the knowledge and get the knowledge updated. It's been, these courses have been translated in many different languages, and it's really wonderful to see them continue to grow. So there's usually a coordinator of the training center, and it doesn't cost anything to become a training center. And in fact, many of the training centers actually provide courses for a fee. So in some cases that is done at very low cost. In some cases it's done in a super amazing way for people who can afford it, with costs then paid for by the students. But we are a nonprofit organization, and we really want to get our education to be available to the most number of pre-hospital providers that we can. I again want to just thank our partners. The American College of Surgeons has been an amazing partner with the PHT, or Pre-Hospital Trauma Committee. And nor I can't do a presentation about NAEMT without talking about our great Norm McSwain. Dr. McSwain has contributed so much to PHTLS in particular, and helped us launch this platform of wonderful courses that are available to you to teach in your country. The American Academy of Pediatrics, again, having the NAEMSP, the National Association of EMS Physicians, the National Registry. These are all organizations that help us here and are partners with us in these courses to make them that much better and have their stamp of approval. It was wonderful to join you. I hope you have questions that we can answer. Please contact NAEMT directly at naemt.org. And I'm just thrilled that you're doing this conference. We very much need to work together across the world to improve pre-hospital care. Thank you, and I hope this was very helpful.